We're going to spend the time today talking about gut health and pull back the layers of what the 4 R's are to restoring gut health.
So if you can put all the supplements or the good foods into your body, but if you're still eating certain foods that are messing with your gut, you're not getting the benefit of all the good things you're doing.
We replace some of these common things in our diet, maybe even in our lifestyle, that are contributing to gut issues. That could be stress, that could be overstimulation. We re-inoculate with these good bacteria, the prebiotics, the probiotics, and the postbiotics, and then we repair. And, finding a healthcare provider that's going to work with you.
I personally think pretty much everybody has a degree of leaky gut because of the stress that we live under in the world. But if you're really suffering, make sure you see and I say functional health practitioner, because a lot of just straight Western medical doctors really don't know how to work with this level of depth of gut health.
Hello, everyone, and welcome back to another episode of For Life, a wellness podcast by LifeSeasons. I'm Niki Wolfe, and today we have a very special guest, Dr. Karen Wolfe. She's a medical doctor from Australia, has dedicated over 25 years to promoting health and wellness with an expertise in medicine, psychology, nutrition. She delivers engaging presentations all over the world. She's also a certified functional holistic health coach and author of 7 books, including Is Your Lifestyle Killing You? She empowers individuals to make positive lifestyle choices. Thank you so much for being here, Karen.
It's great, Niki. Great topic too.
I am very excited. And I have to admit, and all the practice and work and research that I've done in functional medicine, I have not heard, this terminology, the 4 R's to restore gut health. I've heard about a lot of these different ones. So I'm really excited to hear that there is something in place and it's as catchy as the 4 R's. I think there's a place for analogies and things to simplify all this material.
Exactly. It's really good to be able to put something in a nutshell so it's something people can take action with quickly.
Yeah, absolutely. Because sometimes I think we live in the day and age where there's so much information, we get overwhelmed and we don't know how to take action. Now, I'd love to explore a little bit more about your background and what led you into the work, because I know that you were a very competitive swimmer back in the day, and you have to be pretty health conscious when you're competing at such a high level. What did your background look like, and how did you get to where you are now?
Yeah, great question. Yes. I was a swimmer for Australia. I know a lot of people say, well, of course, everyone swims in Australia, and that's true. But back in the day, Australia was really the number 1 swimming nation in the world. And in fact, I don't know if I've ever told you this, but the main competitor for me was a swimmer from Mission Viejo, Nadadors. They were also a very strong swimming nation back when in the day. So I'm talking about a long time ago. So we were very focused on, of course, performance and diet and exercise. And then that's what really drew me to medicine. I thought, I really want to go into medicine and be a sports medicine physician. So then I got into medicine, and my path just led me all different directions. And I didn't go down the path of sports medicine. I became a GP. And I loved that. I loved primary care and taking care of families. And then, of course, my path took me a new place where I fell in love. And I don't believe in accidents, but I came to a conference in the United States, and I fell in love with this American who couldn't live in Australia. So I moved. From Australia to the United States. And then I had a decision to make. Do I do my USMLE, which is the United States Medical Licensing Exam, or do I do something different? And I think many of us have opportunities in our lives to make new choices. Sometimes it's through a divorce. Sometimes it's through many different reasons, changing life circumstances. And when I really thought about it, what I loved was wellness. I loved the concept of, what does it take for human performance, for our bodies to work optimally? So I decided not to go back to clinical medicine and to pursue this path in the wellness industry. And that was back in the 90s. And then I found health coaching, which didn't even exist when I first came here. So I became a health coach, can you believe, 25 years ago. because this health coaching concept is about supporting people to make changes. Just don't tell them what to do. And in medicine, we just tell people what to do, expect people to do it, and that doesn't happen. And it's also not very rewarding for the clinician. So as a health coach, I just love that model. And then I became interested in the whole question of what creates health. And then it comes down to gut health. So that's what got me really into a strong specialty of gut health, because as Hippocrates tells you, all health and disease begins in the gut. So that's what I really focus on now, and supporting people's wellness with gut health.
Thank you for unraveling that. And I think you're right. And it's so fascinating that you got into the health coaching well before it was even a known thing, or, were they calling it health coaching then?
No, really. My first was life coaching. The first one I did, it was called mindful coaching. And then I love the concept so much that I went to speak at a conference, a wellness conference, and I brought the concept there, because true behavior change, in my opinion, happens with a health coach, because you're asking people the right questions and holding them accountable and staying with them. They're doing all the work. So that's how the health coaching movement really got started. And that conference now is like nearly all health coaches. So I kind of created it as I went along.
I think you explained that perfectly, because I'm also a functional health coach, so it could be a little bit biased, but there is something so unique to the power brought by health coaches that we're really bridging the gap between doctor and client. Because how many of us are listening and our doctor tells us your cholesterol's too high, you need to lose weight, you need to make these changes, yet we're not following through. We're not doing them, even though that's what we need to be doing. Whereas a health coach can kind of bridge that gap and ask evocative questions of what would be possible if you were to achieve these, what might get in the way. And like you said, Karen, is, helping them hold themselves accountable. Because I sure know I wouldn't be hitting all the goals I would be without that accountability, whether that's through a partner, whether that's through a health coach. That accountability is key. And so I see that there is an absolute asset to having a health coach if you are on a health journey of some sort.
And I think too, the point, one size does not fit all. And see, in medicine, we really still follow that paradigm that you have this disease, so you have this treatment. Whereas with health coaching, we get to also break through the noise. There's so many choices people have of like how they exercise or what kind of food they eat. But once you start to personalize it and ask the right questions, as you say, you can personalize a plan for someone that works for them and for their lifestyle. Doctors don't. I
think you used a keyword is personalized. I think that's the key. I think personalized medicine is going to be this new focus and this new approach, because you're right. It's high intensity workout can be fantastic for some person, but even that same individual, they might not do well with it in a different season of life. And so having that personalized approach, I think, is so important. Now, we're going to spend the time today talking about gut health and pull back the layers of what the 4 R's are to restoring gut health. So let's start with that first R. What does that mean? And what does that mean for our bodies?
So the first R is remove. So if you can put all the supplements or the good foods into your body, but if you're still eating certain foods that are messing with your gut, you're not getting the benefit of all the good things you're doing. So the first thing has to be removed, and removing a lot of inflammatory substances is usually what we think about the most. And so the first one would be gluten. So the gluten that we eat here in the United States has been very tainted and can be very damaging to the gut, the body in general. And I have people that they complain of fatigue or brain fog or joint issues. And gluten is very tricky. It can show up in people's bodies in all different ways. So don't think it's just about feeling bloated and having indigestion. Your brain fog could be related to gluten or joint issues. So I usually say to people, as a first step, as far as possible, remove gluten from your diet. And It's really not that hard because all fresh foods, by the way, are gluten-free. And then if you're buying packaged foods, if it doesn't say gluten-free, then it has gluten because gluten is a thickener and it's used in sauces and soups and most processed foods. So gluten would be a number one thing. And I like, as a good health coach, we do things in baby steps. Don't try and do everything all at once. But the first thing on the list in terms of remove, I would say, is gluten. That would be the first thing. And then refined sugars, all of those processed sugars that are also hidden very trickily in many places, like ketchup and canned soups. It's amazing how much sugar is in that stuff. So as much as possible, refined foods. And I'm not talking about sugar generally because carbohydrates include vegetables, and eating fruits and vegetables is really healthy for you. So it's the refined sugars that can be damaging to the gut. So gluten, refined sugars. For a lot of people, dairy. Now, you usually know if you can eat dairy or not because you get a reaction to it. So if you eat cheese or milk and you feel queasy afterwards, you generally know. Your body speaks to you. So then you would move over to the almond milk or the coconut milk. And what I usually say is do an elimination trial. So just for a week, cut out dairy altogether and just see. Do you feel different? If you do, then that's a sign. If you don't, then you might be okay with dairy. So again, be gentle with yourself. This is not about doing everything all at once, just figuring out which pieces work best for you. And then alcohol can be very damaging to the gut. So those would be on top of the list of things, inflammatory substances to remove from your gut. And you might find that just that one thing you do, amazing how different you feel. Amazing. Yeah.
Absolutely. I think, touching on the point of meeting people where they're at, and some individuals might be able to do all four of them, but for most individuals, it's taking those baby steps. And it's funny. I like that you mentioned about the dairy because for some, you're going to have a very strong reaction. Once I got pregnant, I've never consumed more dairy in my entire life, and I've never had a negative reaction. I think when you're having the dairy, especially if it's a very high quality, we can have conversations about raw dairy, but organic whole milk dairy, if you're not noticing an overwhelming coating and mucus and you're having these digestive discomforts, you might be processing it pretty well. But if you are noticing that very mucus and you can feel it on your tongue, that might be an indicator to pull this out from the diet. And Karen, we live in a day and an age where purchasing even processed foods now that are gluten-free, it's so readily available. It wasn't like this years and years ago. And my mom has celiac, so she has to be extra cautious. This isn't just a gluten allergy, but there's so many products on the market now that are gluten-free. But to your point, if you're consuming whole, natural, real foods, it's relatively easy to get them in gluten-free. And I have a funny story. As I'm recording, and finishing this season on blood sugar, I got a continuous glucose monitor and it would stay on you. I think it was like 14 days. And I'm pretty conscious and aware of what I'm eating and making sure not to get a spike and a drop. And all of a sudden I had this meal and it was zucchini pasta. So not just like pasta that you buy and you cook it. I shredded the zucchini and cooked that. And, I did some marinara and some cheese and some turkey. So you'd think you'd have the protein and the fat to balance it out. My blood sugar has never climbed so high in every single meal that I've ever eaten. And I was curious about it. And one of my girlfriends brought it up to me. Well, look at the marinara. It just completely went over my head because I think you normally think about the fruits or the refined sugar and all this stuff. And even think about the canned marinara. Not only was there an extreme amount of carbohydrates, but the amount of sugar and the minimal amount of fiber. So to your point, this stuff can sneak in so many areas, your barbecue sauce, your ketchup. So just being more conscious, turning that label around and looking at that. But I think that's a great introduction of let's start with the removal of these high inflammatory foods as the first step. Now, what about the second R?
The second R is replace. So if we're removing things, we want to replace them with healthier options. And there are a few very specific things I do with folks. So, and some of them aren't really obvious. Like, one of the things people don't realize is you should never cook with olive oil. So we know the extra virgin olive oil is really healthy for us, and it is, but it has a very low heat point. So when you heat it, it creates oxidation, which creates inflammatory process in the body. So we replace the olive oil for cooking, and I like to cook with avocado oil. Mm-hmm. Or I know some people do with coconut oil, but you've got to be a little careful with coconut oil because it is saturated fat. But organic avocado oil that I get from Costco, because it tends to be a little more pricey than your cheaper extra virgin olive oil. So that's one thing to replace. And then replacing what we talked about I thought about when you were talking about marinara sauce, someone gave me this great simple recipe to make your own marinara sauce, because that's also tricky. People get this spaghetti sauce on the shelf and they buy it gluten-free. It's loaded with sugar. So all the things they have to put in it too, preservatives, to put it on the shelf. So you get Roma tomatoes and you just grate them and you put your avocado oil and garlic and pepper, put it in the Vitamix, and it makes the best marinara sauce, and it's all fresh. So you don't have to worry about all those added sugars. And the other thing to really think about replacing is, for a lot of people, their digestive enzymes are very limited because just of stress or preservatives and eating a lot of processed foods. So when the food gets to our stomach, it needs to be broken down into as small pieces as possible. So when it gets into the small intestine can absorb all the goodies and then just let go of the rest. And this is where leaky gut happens, in the small intestine. And if the food's not broken down the stomach, the small intestine, bigger particles get in the small intestine, and then that creates this leaky gut for the interstitial cells. So making sure that you have good digestive enzymes, and I'm a big supporter of actually adding digestive enzymes to your supplement regime, especially if you eat spicy foods or a heavy meal. I take them in my purse and I take them to dinner just to have them while you have the meal. So many of us need extra digestive enzymes. And then some of us, and this has crossed over into more of the medical realm, but the acid in your stomach. A lot of people are taking a lot of these antacids. So I always have to say, this is not medical advice. So I don't give medical advice anymore. Everything I do is health education, but I want people to be as good healthcare consumers as possible. And if you are taking antacids, for reasons, whatever reason you're taking them, you can get them over the counter now. If you take them on a prolonged basis, that affects the acid of your stomach, which affects your digestion. So you really want to get that checked out and make sure whatever you're taking is something you really, really need to take. Antacids really are only designed to be taken for a short amount of time, and then for whatever process is creating the problem to be addressed. So anyone that's taking antacid, just make sure you're taking it for the right reason. Don't think it's just an inert substance that you can get over the counter. So that's probably, other than that, it gets into medical information, but it's one of the most prescribed drugs in the world. And now, in my day, you could only get it with prescription. And the fact that it's over the counter now just blows my mind, because I consider it a very active pharmaceutical agent and needs to be really thought through how much you're taking and why you're taking it.
Well, and they've turned it into practically candy. So I know people just pop them as, regular candy. And it's funny because I've filmed quite a few episodes recently. The reoccurring theme in every single episode has been this conversation on antacids. So if you are listening and you are a regular consumer or even somewhat consumer of these, I would look into this deeper and see if this is what's going to ultimately help heal. But more chances than not, it's not an overproduction of the acid in your stomach. It's, maybe that esophageal sphincter isn't working quite accurate. A lot of times it's actually underdevelopment of enough acid and that we need to be consuming more acid, but work with a healthcare professional to determine what's going on. But I would pause and just, before you take something like this, and that's fascinating that this was over the counter or this you had to get a prescription before, and now look where it is. But I think those are
and
great.
I'm the last person that would play this down, because my brother sadly died of esophageal cancer because he had symptoms and he didn't pay attention to it, because a lot of people think, oh, that's just normal. Like having reflux, doesn't everybody have that? And he had that cough, that, this cough that can also be a sign of having reflux issues. So I'm the first person that says, go and get it checked out. When in doubt, check it out and make sure that you are taking the right thing for the right reasons. So I don't want people to say, oh, they stopped their antacids. If you're taking them, there must be something there that you need, maybe a functional approach to look at what's really happening.
Absolutely. I think that's the key point, is looking at a functional perspective, because that's not just going to mask the Band-Aid. It's really going to get to the root cause of what's going on. Okay. So we've talked about the removal. We've talked about the replace. The third are re-inoculate. Let's explore that.
Don't you love that word? Re-inoculate. I mean, it's a charged word considering what we've been through in the last few years. But we, from a functional medicine perspective, are talking about re-inoculating your microbiome. And here's another term that didn't exist in my medical school days. The microbiome is a whole organ in of itself, and it's a new organ. We didn't even know about it back when I went to medical school. And the microbiome, we have all different microbiomes. We have a gut one, and we have a skin microbiome that gets a lot of discussion now with skincare and postbiotics. We have a variety of microbiomes, but we're talking about the biggest one, which is the gut microbiome. And the way I like to explain it is like a rainforest. Imagine in a rainforest where you have all these diversity of different plant life, and they're symbiotic. They need each other for survival. And a forest fire comes and kind of wipes out some of that rainforest, and it's just dead. Well, our microbiome is similar. We need diversity. And with this diversity comes lots of functioning metabolic processes, because these bugs that live inside of us, it's still a weird paradigm to think about, because again, in my medical school days, we talked about the germ theory, which means all germs are bad. And what do you give germs? Antibiotics to wipe out germs. And now we're saying that we have more germs that live inside us than we do human cells, and they all provide amazing functions to every metabolic process. It's a huge paradigm shift that is affecting every branch of medicine. So psychiatry talks about the microbiome and how important certain microbes are for brain health, and every cardiology, every silo of medicine is talking about microbiome. So the best thing is to make sure you have a diverse microbiome. And of course, first thing I like to talk about is food first. So back to the fresh foods we talked about that happen to be gluten-free as well. The fresh fruits and veggies, and all the different colors represent different antioxidants and different food for the microbiome. And in terms of the food, speaking of the bugs, so let's talk about the difference between prebiotics, probiotics, postbiotics. That's a good thing to just get clear. So a probiotic, pro-bacteria, this is live bacteria. So when you take a probiotic supplement, that would be live bacteria that you're taking into your body. Never take that on an empty stomach, because the acidic empty stomach will just break it down in the stomach before it gets to populate the large intestine. So always take your probiotic with food. Prebiotics is what the microbes eat. So the best prebiotic is fiber. So when you have those fruits and veggies loaded with fiber, you are feeding your good bacteria, supporting diversity. I recommend taking an extra fiber supplement. So, because most of us don't get enough fiber just from eating fruits and veggies. So a great high quality fiber product that you might add to your smoothie or sprinkle on your salads. Really good to repopulate that microbiome. And then a postbiotic is when the probiotics break down, the little metabolites are called postbiotics. And we now believe they also form play an active role in many different processes in our body. And skincare in particular talks a lot about postbiotics in their skincare. In fact, we call it nutritional skincare because we start talking about the microbiome and the skin. So re-inoculating the microbiome is eating fermented foods if you love those, taking a probiotic supplement with the strain that is the most tested, and really eating clean, fresh food. So I don't want to make it too complicated, but I like to explain all of the different terms. And doesn't it just come down so much to eating fresh food as nature intended it?
I know. And it's, there's such an overwhelming amount of processed foods and fast foods now that's almost become the norm. But when you come back to the fresh foods, I mean, even getting in the kitchen and cooking it yourself, there's this deeper connection that, helps with your serotonin, helps with just the enjoyment of the food. And there is a connection between the brain and the gut and the brain and how we process. And if we're cooking the meal when we're happy and calm. But yeah, absolutely. I love that we broke down the pre, pro, and post and, different ways to the fermented foods, miso, sauerkraut, kombucha, kefir. Since I was pregnant, I was in a clinical study and I had to consume about 7 servings of fermented foods a day. And so I started experimenting with some other ones. And, I haven't quite acquired the taste of all different types of fermented foods, but I am a lover of sauerkraut. I take that, and my daughter is loving some sauerkraut as well. Kefir, throw that into a smoothie. You could put that in a yogurt bowl. There's a product called Inner Eco, and it's a liquid fermented coconut water, and it tastes absolutely delicious. But I think introducing these fermented foods, because this is going to be that live good bacteria, and it's a win-win when it's an actual vegetable like sauerkraut or kimchi, because you're getting the added benefit of the fiber. So not only is it the good bacteria, it's the fiber, which we know is what the probiotics feed on. So great. We've got the re-inoculate, that fun word that we want to keep saying. Now, the 4th R, repair. What does that look like?
Yeah. So there are some people, of course, that have had chronic gut issues. So the first thing I would say is make sure you see a functional health practitioner if you feel that you want to go the next level in investigating, because there are a lot of different tests. Like there is a test for leaky gut that we can establish if you have leaky gut. I personally think pretty much everybody has a degree of leaky gut because of the stress that we live under in the world. But if you're really suffering, make sure you see and I say functional health practitioner, because a lot of just straight Western medical doctors really don't know how to work with this level of depth of gut health. They'll do the standard tests. For example, irritable bowel syndrome is this throwaway term that often people are given when someone can't figure out what it is. It's an irritable bowel. Well, yes, but something is causing that. So make sure you kind of honor yourself by going the next level in looking in from this functional perspective that we're talking about. So in terms of repair, I really want to say to people, make sure you follow up with a really good functional health practitioner. And then what our gut works really hard for us. So there are certain nutrients that we want to make sure we give our body every day. And again, working from a very simplistic point of view, the first thing you want to do is take a very good multi-antioxidant and mineral supplement that gives you, it's like building a house. You want the foundation built, and the foundation is a high quality multi-antioxidant and mineral that will give your cells all they need to do the work they know how to. Our body is very intelligent, and if we give the body good raw materials, it knows how to do the repair process. So, if you don't know what a good quality one is, then you can certainly ask your healthcare practitioner to, there's a little book you can get called The Comparative Guide to Nutritional Supplements. It kind of rates different ones. And probably if they're the ones that you see over the counter a lot and they advertise a lot on TV, then I would question whether they might be the best ones. You want a pharmaceutical grade I call it multi-antioxidant mineral because I don't just like saying vitamin. It seems like a misnomer to what we're really doing. We want to support good cellular health. Then, interestingly, people don't think about this, but you want to make sure your vitamin D, D for dog level, is optimal. And I say optimal because when you have a blood test, this is another thing, there are many reasons why I left medicine. And some of the frustration I still feel, I remember why I made the shift, and this is one of them. In a lab test, you get your labs back, and the doctor will just say, oh, they're normal. Well, I'm
in range. Yep.
In range. And I'm saying, don't just accept that. Know what optimal is. We don't want to be normal. We want to be optimal. And vitamin D is a good example. The lab will say, if it's 30, it's normal. But optimal in terms of what we're talking about today. And vitamin D is more a hormone than anything, and it affects every part of your body. You want it to be 60 or above. And most people, vitamin D is not optimal. And I was shocked when years ago I first did my vitamin D, because here in Southern California, there's lots of sunshine, and everyone says, oh, it's the sunshine vitamin. Well, no, if you don't have the ability to absorb vitamin D into its active form, then your vitamin D level will be low. And mine was like 24 or something. So I have to nutrient myself with vitamin D every day to be able to get to that optimal level. So I really do a shout out to that, because in my opinion, that should be a number you always know, and always ask for it, because it's not always on a lab test either. You always want to ask. And seasonally, if you live up in the northern states, you want to have one in winter and summer, because it does change throughout the year. So vitamin D, good multi-antioxidant mineral, and then a good high quality fish oil. So even if you're eating good high quality fats through salmon or oily fish, and you're getting your avocado oil, your extra virgin olive oil, for a lot of people, taking an extra high quality fish oil is also a very good thing. It's part of kind of an anti-inflammatory plan. So think about that. So there's some of the nutrients.
Yeah, no, I second that. Our company, we make a wide range of supplements, but a fish oil is something that my husband and I are currently in the market for, of like finding a really good quality, because you can't just take any omega. And we're getting such a disproportionate amount of 6 to the 3, and especially if you're not eating, good fatty forms of fish. But to your point with the vitamin D, even though it is fat soluble and you could become toxic, most people are we do not have enough vitamin D in our system. And that is even with individuals living in Southern California, whether that's a genetic predisposition, you're just not absorbing it, you're lathering your skin with sunscreen. There could be so many different reasons of what's going on. But to your point, go get tested, figure it out, and ask that question. I love that you said that, is what is the optimal range and what do I need to be in? Because normal is just not, yeah, you're right. Do we want to just get by? Do we want to just survive, or do we want to thrive? And that's ultimately what I try to do here on the show, is provide these resources so that we can not only overcome our health challenges, but we can thrive. We can live life to its fullest. And I think you got to start right there, is what is optimal and how do I achieve that? And I think you've done a fantastic job, and I appreciate your work of laying these 4 R's out of how we can approachably attack our gut health. Baby steps. You can go all in and do all of these, and fantastic. Remember, not overstress yourself out, because that can lead to more gut issues. But I think you've laid out enough of, we start with the removal of those high inflammatory foods. We replace some of these common things in our diet, maybe even in our lifestyle, that are contributing to gut issues. That could be stress, that could be overstimulation. We re-inoculate with these good bacteria, the prebiotics, the probiotics, and the postbiotics, and then we repair. And, finding a healthcare provider that's going to work with you, that's going to support you, that's going to be, can give you a little bit more time. And I'm a believer of integrative medicine. I've had to use Western medicine for a lot of things. But if we're really trying to not just not get sick, but we're trying to thrive, I highly encourage looking into a functional health practitioner, a naturopathic doctor, an integrative doctor. I have a lot of friends, colleagues who are, they're not covered by insurance. You can find your way through. There are so many opportunities out there, whether it's a doctor, a licensed professional in some manner. I highly recommend looking into that and pursuing that and making that a top priority.
We forgot to talk about poop.
Oh, so one of my favorite conversations. Let's do it.
Yeah, because people say, well, then how do I know if my gut health is good? That's a good question. So I have this laminated sheet that I use that is the Bristol stool chart. So anyone can look this up. You can Google it, Bristol stool chart, and it shows you 7 different types of poop. And the first type 1 is the hard rabbit pellets, and that's kind of a sign usually that's constipation, dehydration, lack of fiber. So it's a very good guide for someone in this functional health space to know what's really happening inside your gut. And then the 7th type, the opposite of that is liquid diarrhea. So, and I am blown away by how many people think that that's just normal because they've always had it. But that shows that there's a lot of inflammation happening in the system and food is not being absorbed, processed properly. And the ideal poop is the type 3 or 4, which I explain to people is imagine an overripe banana. So it's brown, it's kind of squishy, it comes out easily without much effort, and that is your ideal stool. So that's a very easy guide to know. And of course, one every time you eat is what people in countries that eat pretty much a vegan, plant-based diet, they eat and poop. And my dogs do that. Eat and poop, eat and poop. It's like that's how it works. So and if you have at least one a day, so that'll be my minimum, one a day of that nice overripe banana, then that's good. But I've had people talk about going 4 days without pooping, and that needs attention. So we can look at many different factors. The most obvious one is usually dehydration. We didn't talk about water, but I would put that into replace because people are drinking sodas or high sugary or lots of coffee that's dehydrating. You want to make sure you replace that with lots and lots of water because dehydration is like number one issue for gut issues. So I always like to talk about poop, and it's something that people always remember. Good guy.
Yeah, good point. I am so glad you stopped this and brought us back to that because it is the easiest way to determine, is my gut in line? You don't have to go to get a stool test and go to these fancy doctors to determine, okay, am I going in the right direction? Exactly. Look up Bristol stool chart. I'll leave that in the show notes below. And I've done a number of conversations on it as well, where we want to be in that ideal 3 to 4 range. I've never heard the overripe banana. I love that because it encompasses everything, to the color, to the texture, to the size. We want to aim for that. And one thing that blew my mind, and I talk about poop, my mom used to say, Niki, you need to be working somehow in the poop realm because of how comfortable I am talking about it. But I don't know if that's I don't want to deep dive into somebody else's poop, but I think there's a lot to be said, and our poop can tell a lot about our gut and our health in general. And one thing that was fascinating to me is if you were in that 7, that diarrhea, that could actually be an indicator that you were severely constipated, which you think you're on the opposite spectrum. But what happens is if you're so constipated, the only things coming by is actually liquid. And so that's kind of surpassing. And so being conscious, if you're in that 1 or 7, you really need to start paying attention to your diet, what you're doing. And a lot of it does come back to hydration, making sure we're getting the right minerals, movement, sweating, detoxifying, because your stool carries out all your waste. But if that is not being properly excreted, we're holding on to all this waste. And you talked about it way in the beginning of our conversation, that a lot of times the tip of the iceberg is what we pay attention to as far as for gut, digestion, bloating, constipation. If we don't struggle with any of those, then we must not have gut health issues. But under the surface, you see acne, mood swings, brain fog, irritability, all these other factors, ease of getting sick. All these different things are associated with gut health. And so really looking at the big picture, next time you poop, check it out, assess the situation, let us know in the comments. No, I'm kidding. But, look into it and seeing where you lie on that spectrum and what your body might need. And there's so many resources out there that maybe I'll even do an episode of breaking down each type and what would be supplemental suggestions, lifestyle suggestions, diet suggestions on what would be ideal for that scenario. Any sort of interesting testimonies, doesn't have to be stool related, but of clients that you've worked with gut health stories, experiences, that have been changed through some of your protocols?
Yeah, I think about, usually when I speak and I talk about this and I talk about poop from the stage, and people come up privately to me afterwards because it's a difficult conversation. So this one gal came up to me, and she was in the financial world and lots of stress. And she did not, she goes 5-6 days. That's the normal for pooping. So one of the things I did immediately, and I know you have one of these products, is magnesium is a really good, safe supplement to take. And I particularly like magnesium glycinate for the constipation, my clients with constipation. So I gave her some advice to start with, to get you cleared out. Let's start with some magnesium. And because magnesium is a muscle relaxant, so it not only helps you sleep, but it helps the smooth muscle lining of the colon relaxes, which helps you evacuate in the morning. And I get people to dose up enough till they evacuate. The worst that can happen is you get diarrhea. And she actually contacted me a week later, and it was like magical to her. She couldn't believe her life-changing that she could poop every day. And of course, I know then the repercussions of that, which is, like you said, if you've got stool stuck in you for 5-6 days, those toxins are being released to your cells, and that creates DNA damage and all kinds of disease. So getting someone to poop every day is life-changing. So, and it doesn't have to be that complicated. Like for her, I was able to give her a piece of advice like that without consulting with her. And as I said, magnesium is a very safe supplement. Many people are depleted of magnesium. I think it's one of the most common supplements that levels that we're depleted in. So a lot of us need extra magnesium. So that's always very refreshing that I can help people.
Yeah, what a win. Especially after giving, a discussion and then having these individuals coming back and a week later hearing about that testimony. That's phenomenal. And, drinking coffee, medications, all this stuff depletes our magnesium levels. So, I was going to ask you, and maybe you have a number, maybe you don't, of, what is the range of what we can be taking? And we do sell a magnesium glycinate. And I like that you particularly pulled that out because there's so many different forms of magnesium. And I think magnesium citrate is generally linked to more of helping with bowel support. But I've also found a lot of research. We know glycinate is for nervous system and calming. And exactly to your point, it's going to calm the body enough that it can properly excrete. And so I completely agree with taking magnesium glycinate. And if you take too much, you're going to have diarrhea. Like there's
so
not, from what I understand,
dose safely, easily.
Yeah. It's kind of like the homeopathic or even water soluble vitamins. If you have too many, your body's just going to excrete it.
It was actually on a gut health summit many years ago when, sometimes you just hear one thing that can be so life changing. And I was confused as well of all the different magnesiums. And someone I respected talked about magnesium. I know you say glycinate, so I say glycinate. So magnesium, GLYC, glycinate. And that's when I heard of it. So I thought, okay, that's the one I'm going to start recommending for gut issues. And I've had just such great results with clients. Doesn't mean that citrate may not work, but that's one I use.
And I've done a combination and they've all benefited me, but I think that you can get the added bonus that it's going to help stool, support, but also that mental mind and mood component. And, Dr. Karen, you might be saying it correctly and I could be saying it wrong. So glycinate, tomatoes. But, well, thank you so much for being here and just sharing your insights, your experience, and I think, laying these 4 R's out in an approachable manner, because no matter where you are when you're listening to this, I think there's takeaways that we can all pull and start implementing, whether you're on the 1 type or the 7 type of the stool chart. I think there's something for everybody.
And I did want to just let everyone know, if they're interested in I have a gut health I'm breaking it down, but I wrote quite a long ebook on gut matters, and it includes what we're talking about today and even more. I do a lot of discussion about the brain-gut connection, and that's free for folks if they want to get that at drkarenwolfe.org/gut matters. So you can dig in there, and I think I even have a picture of the Bristol stool chart in there for folks.
Fantastic. Okay, so we will make sure to include that in the show notes. Any other places where individuals can find you?
My website generally, drkarenwolfe.org. I go on social media a little bit, and it's always Dr. Karen Wolfe. So, but my website, if you go to resources on my website, I have been very prolific with a lot of great ebooks. I love to educate, so I have a lot of different topics there that you can explore. So under my website and resources, I have Karen's Kitchen there. I am not a cook, but because, when you're in this space, cooking at home is really important. So I'm the cook for non-cooks, where I make little YouTube videos in my kitchen of things like spaghetti squash or cabbage steaks, just easy things to cook to start replacing some of the foods that maybe aren't so healthy for you. So you can take a little look at Karen's Kitchen on my website.
I like that, and play on words. And you know what? Not everybody listening, I think that makes it so much more approachable, because not everybody's going to be a Michelin star chef or wanting to, pull out 20, 30 different ingredients, or maybe they're overwhelmed by the intensity of it. And it sounds like it's simplified menus for the average individual to start implementing this food, healthy, nourishing food into our day and diet. And you don't have to be, a chef to be able to make this happen.
Right. Or busy moms. We've got a lot to do in our life. So fitting in healthy cooking for a lot of people is like, they say, I can't do that. So they order in, but truly with just a little planning ahead of time, like I know you do your meal planning ahead of time, then you can cook at home very healthily and easily with a little planning.
You nailed it right there. I've seen a lot of videos where there's certain individuals sharing, what do they say? I'm a low income mom, and this is the meals that I make. And you see them giving their kids donuts and all this different stuff. And doctors and certain influencers are recreating that and showing you can make healthy food at the same cost, if not cheaper. Because when you're buying the raw ingredients, carrots, broccoli, fruits, you don't have to spend money at an Air One or get these fancy meals to eat healthy. You could be spending the same amount of money as a packaged donut, at your dollar store. You could be getting real, true ingredients. So I think, just questioning what my circumstances are and how I can overcome that. So, Well, thank you so much for being here. We will make sure to include all the resources in the show notes. But I really enjoy this conversation, and I think listeners will as well.